What's going on, everybody? I hope you are having a blessed and beautiful day today. I have a few articles that I want to read for you today that I started seeing it on Twitter and I thought I would share it with you guys. And again, as usual, I will not be mentioning any certain words, but you will understand what I am talking about as I read through these articles for you today. The first one comes off of CNBC, and the title says, "Yes, your boss can fire you if you refuse to get the vaccine." This says here, the country's first vaccine could be authorized for emergency use as soon as Thursday. If Pfizer and BioNTech get the green light, distribution is set to begin within days. But as difficult as the research, development, and distribution stages have been, some experts argue... there's ads that pop up. Hang on, I'm trying to get the ad off. Okay. But as difficult as the research, development, and distribution stages have been, some experts argue the hardest part of fighting the virus is actually what comes next, pay attention to words again, right? Convincing the U.S. population to take the vaccine. Convincing, right? There has to be some form of something behind it. Like it's going to make your life better. It's going to cause you to live your life and have your best life now. You can keep your job. You can go and you can fly. You can buy products. You can buy food. You can sell. Here we go. Okay, it says roughly 4 in 10 Americans say they would definitely or probably not get a vaccine, according to a recent survey. While this is higher than it was 2 months ago, to achieve herd immunity, experts say that about 70% of the population needs to be vaccinated or have natural antibodies. Employers, however, may not be taking no for an answer. Under the law, an employer can force an employee to get vaccinated, and if they refuse to take it, they can fire them. A couple of my corporate clients are leaning towards making the vaccine mandatory, said Rogue Dunn, a Dallas labor and employment attorney. His clients range from companies in manufacturing to food and beverage industries that have been battered for months due to the pandemic and government-mandated lockdowns. A vaccine promises employers a return of some form of normal, which is desperately needed as businesses look to recover profits. Mandating the vaccine in the workplace. One of Dunn's clients in the restaurant sector thinks a compulsory inoculation requirement could be a game changer for businesses. They think that it gives a competitive advantage, explained Dunn. They could say to their customers, "Hey, our restaurant is safe. All of our employees have been vaccinated." It may be in part a PR tactic, but Dunn said it is totally within an employer's right to implement this kind of requirement. Under the law, an employer can force an employee to get vaccinated, and if they don't take it, they can fire them, said Dunn. Dorit Reese, a professor at the University of California College of Law, said that private businesses have pretty extensive rights. Requiring a vaccine is a health and safety work rule, and employers can do that. Take the healthcare system. Dr. Hannah L. Salai, who oversees a clinical trial for Moderna's vaccine candidate, believed the hospitals could eventually make inoculation a condition of employment, similar to how the annual influenza vaccine is required of all medical staff. We all have to demonstrate that we took our flu shot before we go out to see the patients in the wards, she says. When we are sick, we cannot deliver vital function to the community. There are, however, a few notable exceptions to this kind of blanket requirement. If a workforce is unionized, the collective bargaining agreement may require negotiating with the union before mandating a vaccine. Anti-discrimination law also provides some protections. Under the Americans with Disabilities Act, workers who don't want to be vaccinated for medical reasons are eligible to request an exemption. In this case, an employer would have to provide reasonable accommodations accommodation, such as allowing the employee to work remotely. Under Title VI of the Civil Rights Act of 1964, if taking the vaccine is a violation of a sincerely held religious belief, they too would permanently be able to opt out. When the FDA meets this week, they will decide whether to grant an emergency use authorization or an EUA to Pfizer and BioNTech. It may seem like semantics, but the EUA is not the same thing as full approval. An emergency use authorization is not a license. There is a legal question to whether you can mandate an emergency observation. The language in the Act is somewhat unclear on that. Mandatory vaccination protocols, therefore, may have to wait until the FDA completes the entire approval process for the Pfizer vaccine. What is clear, however, is that if an employer does not choose to mandate the COVID vaccine, whoops, I said it. Well, we're going to just keep going with it. A company is not liable should an employee develop side effects from a vaccine. Instead, experts say that any claims would be routed through workers' compensation programs and treated as an on-the-job injury. For now, Dunn is advising his clients to wait 3 months until after, 3 months until after the significant number of the population has been vaccinated. In the meantime, some of the businesses Dunn represents are considering incentives instead. There are a few carrots that employees could offer. One option is that if you get vaccinated, you don't have to have your temperature taken every day, or you don't have to wear the same level of PPE. There are also talks of offering financial perks to employees who opt in taking the vaccine. Why is there so much push towards this? Why is there so much, we're going to pay you if you take the vaccine. We're going to give you this. We're going to give you that. Does that not sound like the beast system to you? Because that certainly does to me. It's not going to be just this, take this vaccine. This is going to become where people are going to be squeezed out of this, and it's going to be where the resistors are the ones that are not taking it, and you're the problem and not them. So, there's such this huge push for this. If you take it, we'll give you this. It's like a bargaining chip. Let's see what it says. There is also talk of offering financial perks to employees who opt in the taking a vaccine. Dunn said some of his clients, including a restaurant and one company in the manufacturing sector, are seriously considering giving a cash bonus to employees who get vaccinated. And for those who still refuse, rather than firing them, Reese said employers could require that they complete an education course that delves into trial data and experience of participants. Brainwashing? Yeah. This person, I can't say their name. Yasir, I can't say their name. A 24-year-old living in Boston area was one of 30,000 people who joined the trial of the Moderna vaccine. Despite initial concerns about the potential side effects, he said he's no longer worried. I'm not too concerned about actual long-term effects, said this person. We know from most vaccination trials that any adverse effects show up within the first couple of months. Ultimately, the U.S. is still in the midst of an employment crisis. Record unemployment numbers have put immense pressure on the labor market, especially in the service-based industries where workers are most at risk. That is a big part of why the Center for Disease Control and Prevention has advised prioritizing frontline employees in the key for vaccinations. So workers may not have much of a choice if they want to keep a job. It's kind of interesting, isn't it? Okay, so then I had another article that I wanted to read that I just came across, and it was about how New York is planning to make the vaccine mandatory because they realize that how many people are choosing not and don't want it. So they are going to force it. Now I'm going to find that I just saw, and then I'll be right back. Okay, here it is. It's from fox5newyork.com, but you can find it everywhere. When I click this in to Google, it's everywhere. Anyways, the title of it says, New York legislation could make this vaccination mandatory. A New York lawmaker has proposed mandating vaccinations against this virus if not enough residents voluntarily get the shot once it's available. Assembly member Linda Rosenthal, who represents part of Manhattan's West Side, earlier this month introduced a bill that would require the state to safely and effectively distribute the approved vaccine. In accordance with the Department of Health, this vaccination administration program, according to the language of the legislation. While steps have been taken to reduce the spread of this virus, epidemiologists and public health experts have concluded that a vaccine will be necessary to develop herd immunity and ultimately stop the spread of the disease. The bill's support memo states the state must make efforts to promote vaccinations and ensure that a high enough percentage of the population is vaccinated against this virus to develop sufficient immunity. Okay, and this says de Blasio, vaccine expected to arrive in New York around December 15th. That's just a few days away. Once the vaccination program has been rolled out for a while, the Department of Health would have the authority, oh my goodness gracious. Once the vaccination program has been rolled out for a while, the Department of Health would have the authority to mandate vaccinations to anyone who can safely receive the vaccine. If public health officials see that New Yorkers aren't developing sufficient immunity from this virus, the bill doesn't define sufficient immunity, so presumably public health officials would have to set the benchmark. So it's up to them. They get to decide, what is safe and what's not, and who needs to be vaccinated and who doesn't. At this time, experts don't know the percentage of the population would need to be vaccinated in order to achieve a so-called herd immunity to this virus, according to the CDC. Herd immunity is a term used to describe when enough people have protection, either from previous infection or vaccination, that it is unlikely a virus or a bacteria that can spread and cause the disease. As a result, everyone within the community is protected, even if some people don't have any protection themselves. Rosenthal's bill would allow someone to be medically exempt from mandatory vaccination if they get a letter from a licensed medical professional, which the doctors are in on this too. So the doctors aren't going to give you a medical exemption. It's either going to be, okay, you're either going to get this vaccine or you're going to stay at home. That's what they're going to give you, a handwritten note for. Assembly Bill A11179, as it's designed, is sitting in committee according to the Assembly Bill Tracker. Pharma companies AstraZeneca, Pfizer, and Moderna have developed vaccine candidates that performed very well in phase 3 clinical trials. AstraZeneca reported that its vaccine is safe and about 70% effective, according to studies. The United Kingdom has already approved Pfizer's vaccine for emergency use. Governor Cuomo has said the first batch of the dose of Pfizer vaccine will go to nursing homes for residents and staff next week. Then a batch of vaccine doses from Moderna will arrive soon after. So why is it that they're going to the nursing homes first, may I ask? Is it possibly because they're older and they want to get rid of these people? Do you remember a while back, Bill Gates was talking about population control and how as you get older, I think I did a video on it actually just a few weeks ago, how as you get older, you're costing the air more, so leave the space for the younger. So why, per se, are they bringing the vaccine to the elderly first and to the nursing homes first? Could it possibly be that they're trying to rid the economy of the elderly first? Makes sense, doesn't it? Okay, that was it. So I wanted to share that with you that, things are, it's not going to become the mark of the beast while we are still here. The mandatory things are not going to happen while the church is still here. But we are seeing talks of this, and I firmly, firmly, firmly believe that this vaccine is in fact the mark of the beast, will become the mark of the beast. There are things in this vaccine that are proven to be the mark of the beast. There was an article just the other day, I think I read it. I don't remember exactly where it was from. I don't remember word for word where it was from, but I think it was even in New York, where they're trying to convince people, oh, this isn't the mark of the beast. This isn't satanic. This is just a vaccine. Now, why would they say that? Right? It's like conditioning. They're trying to brainwash and condition you to believe a lie. Believe the lie. They're trying to say, oh, don't worry about it. There's nothing wrong with it. It's just a normal vaccine. There's nothing satanic. I mean, these are the words that they were saying. There's nothing satanic. There's nothing demonic. This is not the mark of the beast that you've been hearing about. And I'll be the first one to take it. In fact, I think it was Cuomo. He went to a church. I'm going to have to look at that really quick. Yeah, it wasn't Cuomo. It was de Blasio. So it was in New York. So many people are beginning to recognize saved and unsaved people that are lost. They're beginning to see things that are changing. They're beginning to see and hear the believers what we're saying, and they're kind of putting two and two together, and they're starting to panic, and they're starting to get uneasy, and they're beginning to see, hey, wait a minute. These things that these Christians are saying are actually coming to pass. They're coming they're coming to truth right now. And how could a Christian back in 1987 have predicted all of this unless it was true? So they're beginning to say this. So Satan is very cunning and he's very slick, and he's going to try to start trying to calm the masses, right? And trying to brainwash the people into thinking his way and thinking that it's not exactly the truth. This isn't, the Christians don't know anything. That's not the truth. This is the truth. Or it's not as bad as it seems. This is not as bad as it seems, but he's playing his hand right in front of people, and many people are going to be blinded, and they're going to take the lie. So this comes from the Highlander.org, and it says the new vaccines are not, quote unquote, the mark of the beast. So this is what de Blasio was saying. I'm not going to read the whole thing because it basically kind of goes over the same thing that we just did. I'll read a little bit. Since the virus broke out at the end of last year, multiple pharmaceutical companies have been trying to find a cure. Luckily, 2 companies announced that they have created a vaccine with a high success rate ranging from 90 to 45%. Didn't we just read that it was like 74%? But now this one says 94%. Okay. These announcements have sparked hope since they signify the possible end of the pandemic. However, users on TikTok have been posting videos spreading conspiracy theories, using religious explanations to claim that the vaccines are a microchip intended to place in people. Users of the app have gone on to declare the vaccines as the mark of the beast, a story that originates from the Bible. These claims, however, here we go, hold no scientific basis and are not rooted in fact. Rather, the vaccines are assistant to the perilous situation the world is facing. They don't even realize the words that they're using, right? They don't even read the Bible. Perilous times, perilous situations. Here we go. The conspiracy theories only help spread misinformation. On TikTok, conspiracy theories have spread claiming the vaccine is actually a microchip the government wants to install in the population. One popular video made by a user of the app acts out what she believes the vaccine is. In the clip, she claims the vaccine is a microchip and the refusal of it leads to people being killed. In the caption, the writer writes, "You're required to take the mark of the beast or vaccine, or you die. But you know what God's word says, so you deny it." The creator of the TikTok video is referencing a story in the book of Revelation about a mark placed in people who serve and worship the creature called the beast, enslaving them to him. In modern times, many people of the Christian faith fear technology, specifically microchips and the government, which they characterize as evil entities. Refusing vaccine is not uncommon. In fact, the anti-vaccine movement stated started at the same time the vaccines originated. People found vaccines barbaric because they did not like the way Edward Jenner, the creator of the smallpox vaccine, exposed his family to pathogens of sick cows. Yet the rejection of this vaccine is due to made-up notions, which is ridiculous, even more considering how the vaccine is necessary to save human lives. To think that this vaccine is evil due to conspiracy theories is not logical. Small websites dedicate themselves to creating these theories, explaining their beliefs with explanations like, there is a bill currently before the House of Representatives, 666. And the very letters, you know what, the virus, this type of reasoning is not substantial. It does not make sense to link minuscule details like the number of letters in a word to phrases in the Bible and claim that they are an evil plot. While the majority of the public is not seeing these conspiracy theories on the websites, the conspiracies are being shared on TikTok where many people learn about them. This mass sharing of false beliefs is frightening, and it could potentially cause members of the public to refuse the vaccine. It is understandable that the public is fearful during this time, especially considering that the political atmosphere around us. Yet we must not be fearful of this. Everyone must put aside their fears and political reservations to see the advancement of medicine is designed to aid us. To refuse this vaccine is to permit the outbreak to continue indefinitely. Here, the vaccine is not an attack on citizens out of evil intentions. It was created out of concern. So, yeah. They are evil within evil within evil, and they are trying so hard, and it's working on some people to brainwash these people to believe that their agenda is not exactly what the Christians are saying. Everything the Christians are saying is false representation of this vaccine that's going to heal the world, right? Now, have you ever in your entire life, ever, seen a vaccine that has traveled around the world globally to help assist with a global pandemic? I sure haven't. So all of these things are adding up. Like I said, I believe we are going to be so out of here so fast. And I believe we are going to be out of here really soon. And we are definitely going to be out before it's mandatory. And I don't believe that God is going to allow his bride to be injected with DNA altering ingredients. They are his bride and they are his prized possession. He's going to take her out of the way before any of this stuff happens. And because of that, you better hold on, because we are getting ready to fly. We are getting ready to fly out of here. And anybody that rejects that truth is either blind or they're in rejection themselves. So don't listen to people that, keep telling you that, the tribulation is, we are either in the tribulation or we aren't going to be raptured, because there's no secret rapture. That's baloney, baloney, baloney. Don't listen to them. In one ear, out the other, and move on. If they don't want to, go in the rapture, then they don't have to. That's between them and God. But I plan on being with him, and I plan on going. So, that is what it is. If you think that you have to endure all of this tribulation that's coming, then you are adding works to your salvation, and you're thinking that you're better than everybody else. And you think that based on the works and the person that you are, that God is going to have favor upon you because of the works that you do, that he's going to give you a big pat on the back and say, good job. That's not the way it works. That's not what the Bible states. And, we are going to go home because we are the bride of Christ, and he loves his bride. We are waiting eagerly for him. We are dressed and ready for our wedding, and we can hear him in the distance. We can hear the bridegroom coming, and he is coming soon. So, if you don't know Jesus, today is the day that you make that choice today. Don't wait until tomorrow. Don't wait until your deathbed, because you're not promised your next breath. And once you die, that is it, and it's too late. There are no second chances. Once you take your last breath, you're taking your first breath in eternity, wherever that is. So You see the stuff that's going on in this world. You see the stuff with this vaccine and how it's becoming mandatory, and you can't fly unless you have this vaccine pass. You can't go into stores unless you have vaccine passes. This is where this is headed, and we can see behind the veil curtain that the tribulation is just on the other side, and we are very swiftly headed towards that way, which means that our redemption is not only drawing near, but he's on his way. So I wanted to leave that with you. This is getting kind of long, but I wanted to read those articles for you today and just show you just how close we are to Jesus coming back, and just hold on a little bit longer, guys. Don't lose faith, and don't lose heart, because Jesus is coming. So I'm going to leave that with you guys. I love you, and I hope you have a blessed and beautiful rest of your day.